I'm Dr. Arthur Calabretta. Today at Modern Salon and Spa we will do a demonstration of a Botox injection. Our model today will be Heather, and I will be explaining how Botox works as well as the possible risks, benefits, and alternatives. Good morning, Heather.
Good morning.
Can you tell me what you're in here for?
Yes, I have lines in the middle of my forehead, between my eyes, and then on my forehead that are fairly unfortunate that I would like to get rid of.
Okay. Well, let me explain a little bit about those lines and Botox and how it works. What I typically do is, you'll take a look at your face and go ahead and frown for me real hard. All right. So when you frown, you can see these lines. And if we just go ahead and frown, okay, you can see how deep, and you see these little bumps right here? Those are the muscles that squeeze together to cause that line. Now raise your eyebrows real high. Okay. Again, the muscles are pulling her up. And now go ahead and squint like this. There you go. And you can see these. Those are the three main areas. Thank you. Those are the three main areas that we work with Botox to try to smooth out. What I typically do is I show the patients this picture. Okay? These big muscles here are the muscles that make you get those transverse lines across your forehead. Those muscles are the only muscles that make your eyebrows go up and down. Then we have these muscles between the eyes, and that's what makes the brows come together, and that's what gives us the lines, the 1, the 11, the 1, 1, 1 between the eyes. And then this circle muscle around here, when we squint, causes a little pleating around the corners. Now, this is a little more complex because these muscles that come up like this are our smile muscles.
Okay.
And when we smile, the whole cheek complex goes up. So we'll still get lines going up. So those will still be there, but when it gets rid of those squinting lines, and so it helps you there. I find that people that are very athletic, and they work out a lot, even though you're working out your body, you don't realize you're making faces too when you work out. And so sometimes these muscles are a little thicker in people that work out. So we find that they're pretty strong, and by putting the Botox in there, it blocks it. So that's kind of how Botox works.
Okay.
If I do somebody's forehead, I usually will leave about a finger's width above your eyebrow on the outside here, where I don't put Botox, and that's so you continue to have expression.
And it looks more natural.
It looks more natural, yeah. The brows will move. It's not this frozen look. Okay. Over here, it doesn't matter as much because you don't want to have those lines anyway. So that's pretty much how the muscles work and when we do the injection. When I do the injection, I inject right through here. There's probably like 2 injections on this side, 2 injections on that side, and that pretty much works there. When you're doing the forehead, it's a little series of sticks across the forehead in like 2 rows. And if you do the crow's feet, it's about 3 little sticks, 1 up under the eyebrow, 1 at the corner, and 1 below. The average Botox effect takes about 3 days. Okay. Some people, it'll work in a day. Some people take 4 or 5 days, but the average is about 3 days. It lasts for roughly 3 months.
Okay.
Again, some people it's 2.5, some people it's 4. It's like any other drug. We metabolize them at different rates,
okay.
And that's why they last at different times.
Is there anything after I get the injection that I should do to massage it or to have it to be more effective? Is there anything on my end that I'm responsible for, or just let it go?
Yes. What I usually tell my patients is that after you do the Botox injection, you don't have to massage it. I don't want you massaging it because you can push it places you don't want it to be. But I tell them no exercise for 24 hours, okay. No laying down for 4 hours,
okay.
And the rest of the day I want them to move that muscle as much as possible. The reason for that is the way Botox works is it blocks the nerve that goes to the muscle. It's like shutting off the electricity. Okay. So when that's injected in there, it's just sitting in the muscle. The more you fire off the muscle, the more the Botox goes into the nerve end and blocks it. Once it's in there, it blocks it. Okay. And the way it wears out is that the drug wears off and the little nerve endings grow back into the muscle and start working again.
Okay.
What I'll do is I'll explain to you the risks, benefits, and alternatives of doing Botox. There are different competitors. You'll hear about Botox, you'll hear about Dysport. They're basically the same type of drug. I prefer to use Botox because I've used it for thousands of injections, and in my hands I get pretty good results with it. There's really no need to switch from one to the other. As far as the possible complications you can get, the most common thing is you can get a bruise. You're sticking a needle in your skin. Whether I stick Botox in there or just stick a needle into you, you can bruise. People that are on aspirin, Motrin, Advil, all those type of things, they have a higher incidence of bruising. Okay. If you do get a bruise, it could last you a week to 10 days, but it goes away.
Okay.
Next thing is possibility of infection. Again, you're sticking needles in people. So with a needle stick, you can get infection. It's pretty rare. I haven't seen it, but it can happen.
Okay.
Some people can be allergic to anything. Again, I've done a lot of injections, and it's pretty rare to ever see somebody with an allergic reaction.
If somebody's allergic, what will you see? Just itching or burning, or
it can be any reaction.
Okay.
Just like if you had a bee sting, it could be just itching. Okay. It could be a swollen area. It can be an anaphylactic shock. Again, I haven't seen it, but those are the typical things that you do. Then there are more rare problems that you can get into, and it has to do more with the dose that you get and the location that you're getting it in. One of the problems that you can get into is possible droop of your eyelid. And the reason you get that is if you try to put Botox down over the eyebrow or close to the eyelid, if some of that gets onto this little muscle that makes our eyelid go up and down, it's going to make the eyelid droop.
Okay.
It's not a permanent thing, but it's a big hassle for a couple of months. It could be a couple of weeks, it could be a couple of months.
Okay.
But it's not a permanent thing. None of these things are permanent. A lot of people ask me, well, if I do Botox, do I have to keep doing it forever? The answer is no. You probably will just because you like it, but you don't have to.
Okay.
Botox is one of the few things that actually will stop the clock or really slow it down. I can do a facelift on somebody today, and tomorrow what happens? Gravity starts to make the face go down, and over time it gets droopier. When you put Botox into that muscle and we stop the muscle from working, we've just stopped the clock for 3 months. So the amount of thousands of times that you would move these muscles over that 3-month period, you're not doing it. So therefore that crease is not getting any deeper. You know, you've been moving those muscles since you were born, but when we're younger and the skin is more elastic, you haven't cut the lines in yet.
Okay.
As we get older, that line gets deeper and deeper and deeper, and to a certain point, you can't get the line out because it's so deep.
Okay. Experience with Dr. Calabretta and getting Botox for the first time was quick, easy, and painless. I had pretty high expectations, but my results completely exceeded my expectations. I thought that I was going to have less movement and therefore I was going to have less wrinkles and my face was going to look more smooth, my skin was going to look more smooth, but I literally felt like an eraser had been drawn across my forehead. So even now when I raise my eyebrows, which I'm doing, I know it may be difficult to see, but I am raising my eyebrows, and when I do that, I literally can't see any wrinkles, but I still feel like I have a little bit of movement, so therefore it's more natural to me. So even when I squint my eyes, I feel like I can still do it, but the line that was there, which was very visible, I can't see anymore, and I absolutely love that. I feel like I just had a facial, which I didn't, but that's what I feel like because my skin feels refreshed, and it was painless, it didn't hurt at all. He was absolutely great in telling me exactly what it was going to feel like, when, what he was doing and when, what the results were going to be, and I saw those results within 24 hours, so I couldn't be happier.